Hi, I'm Fatima Bhutto. Welcome to the Exchange at Zeteo. Today I'm speaking with Doctors Tanya Haj-Hassan and Rebecca Inglis. Dr. Tanya Haj-Hassan is a pediatric intensive care and humanitarian doctor. She spends half her year working with Doctors Without Borders and has served on medical missions throughout Africa and the Middle East. Dr. Haj-Hassan has been visiting the West Bank and Gaza Strip for over 10 years to teach medical school students alongside a group of doctors and surgeons from Oxford. She has also been serving as a spokesperson for MSF on Gaza since October 2023, and in that capacity has attempted to share with the world the immensity of the catastrophe that is unfolding. Dr. Rebecca Inglis is an intensive care doctor and a fellow of the Faculty of Intensive Care Medicine. She is also a member of the UK Emergency Response Team and has also previously worked with Doctors Without Borders. Her PhD and postdoc research focuses on strengthening of the healthcare system in low-resource settings. Like Tanya, she has also been visiting Gaza since 2016 to teach medical students and junior doctors. In an urgent effort to amplify the voices of medical professionals in Gaza, both Tanya and Rebecca have set up the social media platform Gaza Medic Voices, at Gaza Medic Voices, in October 2023. And medical professionals from Gaza have shared their harrowing first-hand testimonies over the past 7 months through that platform. Both Tanya and Rebecca are also collaborating with a Palestinian organization called Healthcare Workers Watch Palestine to investigate and document the detention and abuse of Palestinian healthcare workers by Israel. Thank you both for speaking to me today. And I wanted to start with you, Dr. Haj-Hassan. You've recently returned from Gaza after several weeks there on the ground. Can you tell us what it was that you witnessed there, both in terms of the cases you're seeing and also the challenges, and perhaps give us a sense of how that has changed from previous visits?
Yeah, thank you. So I don't think there's any comparison between what's happening in Gaza now and any of our previous visits, even if we did notice with each subsequent trip that we went, the conditions had deteriorated as a consequence of now a 17-year siege on Gaza. What I saw this last time was utter and complete carnage affecting primarily families. And we spent our weeks there living inside one of the hospitals in the middle area of Gaza. I worked primarily in the emergency department and the intensive care unit, and occasionally the pediatric unit. And the majority of cases that we saw were children, at least in the ICU, which is an adult intensive care unit. Of all the beds, all but one were occupied by kids, kids with traumatic injuries for the most part. The emergency department, every few hours, we would receive a mass casualty. Families coming in, those who were still alive on arrival to the hospital, would be brought into the emergency department. And you would just see plumes of smoke and weapon debris as they were brought in. And we would have to make out which ones we need to resuscitate immediately and which ones can wait, and which ones we don't have time to resuscitate because their chances of survival are much slimmer than the others that may have a larger chance of survival. Because of the conditions, the majority would be resuscitated on the floor. So there would be blood everywhere. Injuries that we saw were head injuries, often with exposed brain matter, shrapnel injuries, penetrating shrapnel, bullet wounds, occasionally to the legs or the head, even in children, and really terrible burns. You would smell burning flesh of children sometimes when these mass casualties came in. And then you would hear the screaming, the fathers walking around calling for the names of their children because they can't find them. And they were brought in by ambulance, but they don't know if they were able to retrieve their families from the rubble. Kids screaming for their parents, and everybody just walking around chaotically trying to find loved ones, hoping that they were actually brought into the hospital, because at least that would mean that they were retrieved from under the rubble alive. And for us as physicians, it meant and nurses were on our hands and knees resuscitating in pools of blood as this completely life-shattering catastrophe is befalling all of these families, and you're trying to be empathetic and help dad find his only surviving daughter, but at the same time resuscitate, the two children that you have on the floor, but out of the corner of their eye, you see a woman with 4 children covered in debris in the corner, and you can't remember if you checked those 4 children, because they come in and, with blast injuries, it's not all obvious where, how injured the child is on the outside. You really need to do a thorough check. We do ultrasounds to make sure that there's no internal bleeding. And, I'm looking at the corner of mine, I'm thinking, did anyone check those kids? And I'm screaming, so-and-so, are you available to check those kids? So-and-so, are you available to do this? But the problem is, because this has been going on for so many months, there's been a serious brain drain as a consequence of the direct killing of senior doctors, the abduction of senior doctors and nurses, and also the fleeing of senior doctors and nurses. Anybody who has a family who worries about their own survival and the survival of their families, if given the opportunity, is going to leave Gaza. And so if you're a senior doctor and you have the financial resources, you may have opted to evacuate at this point and pay off, these bribes to evacuate Gaza. And so we have the hospitals primarily run by very junior physicians who have fled from other areas of Gaza and are essentially working as volunteers. So they work without pay, 24 hours on, 48 hours off. Although a lot of them spend most of that 72 hours in the hospital doing what they can to resuscitate patients. So it's utterly and completely catastrophic. And just for context, this specific hospital is not one of the main hospitals in the hospital. And normally it's the type of hospital that would be referring its more complicated cases to Al-Shifa or Al-Nasser Hospital, 2 hospitals that have been put completely out of service. Al-Shifa utterly and completely destroyed after multiple besiegements and bombing and invasions. And Al-Nasser, again, besieged, invaded, and partially destroyed. And so you have a smaller hospital functioning as one of the main hospitals in a strip of land that is completely devastated, has a healthcare that's completely devastated, and is receiving mass casualties at a rate that no hospital or no healthcare system in any country where I've worked. And just for context, I went to medical school in the UK. I worked for the National Health System, and then I moved to the United States. I did my pediatric specialty training in the US, one of the best children's hospitals there. And now I'm in Toronto, again, working in one of the best children's hospitals in North America. All of these institutions, who are referral centers for the entire country, would not be able to handle one of the single mass casualties. And when I say handle, I mean in an organized way with all of their expertise and equipment and space. And that just gives you context of the dire situation that has not been going on for the last month or 2 months, as the media suggests when they say things are deteriorating to catastrophic levels. We've been running out of words to describe what's been going on since October.
Mm-hmm. Mm-hmm. And can I ask, in any of the other missions that you have been a part of, whether in Africa or the Middle East, is this common that the majority of patients coming into the ICU are children?
No,
Is there any?
No, war wounds in general, war casualties tend to be young men. That is, in any war zone, the majority of young casualties will be young men. And when I say majority, 85, 90% of the casualties are going to be young men. What we see in Gaza is an exact reflection of the demographics of the population. Gaza's population is about 50% children. 48% of the casualties are children. Same thing when you look at the demographics of women and elderly. This is an indiscriminate targeting and an elimination of human life. It doesn't matter whether you are a militant or a fighter or not. It just matters that you live in Gaza. And we've seen it even with foreign humanitarian workers and local humanitarian workers, local journalists. It has killed every single demographic of society at a rate that is unprecedented in terms of speed and magnitude of any conflict that I have either directly been part of in a humanitarian capacity or followed in the media.
Rebecca, you've been busy these past few months collecting testimonies from healthcare workers in Gaza in collaboration with Healthcare Workers Watch Palestine. And you've been spending quite a bit of time doing the analysis on those testimonies that are coming in and looking at recurrent themes. And I want to talk to you about two of the things that we're not seeing widely in the press, but that you're finding in these testimonies. And the first of those is the detention, and not just the detention, but the torture of Gazan paramedics, doctors, and nurses. Can you tell us what you're seeing?
Yes, sure. So I think the first thing to say is that this is not a small scale problem. It's not a handful of doctors, a handful of nurses. We've documented over 200 healthcare workers having been detained during this current conflict, of which over 2/3 have been taken from hospitals or from ambulances. So these are healthcare workers who are taken while they are doing their life-saving work. What we've been doing is not only documenting those that are in detention, but when they get released, we've been speaking, and as you mentioned, the organization that we're working with has been collecting a lot of these testimonies on our behalf. They have been talking to nurses, doctors, paramedics after their release from Israeli detention. And some of the things that we've been hearing have just been absolutely horrendous. So they describe not only the conditions under which they are first taken. So they're, as I mentioned, many taken from hospitals. They're stripped, blindfolded, their hands tied with cable ties, and herded into vehicles and then taken to Israel into various detention centers. But it is done with extreme violence towards those detainees. So they describe being repeatedly hit, with steel-capped boots of the soldiers, with weapons, having muzzled dogs set upon them. And they describe the vast majority of this violence perpetrated against them while they are completely unable, their hands are tied, they're blindfolded. Within the detention facilities, they also describe similarly horrific conditions. So common themes that we hear about is frequent use of threats of sexual violence, either against the detainee or against their family. So rape threats against their families. We have a small number of the testimonies that we've taken have included actual penetration of bodily cavities during the abuse. They talk about the conditions in which they're kept. So without adequate medical care, they talk about the use of handcuffs and ankle cuffs as a form of torture. So they describe either having their hands cuffed in front of them or behind them, and them being tightened to the point at which the blood supply to their hands or to their feet is cut off or impaired, and people get horrendous ulcers at the point at which the cuffs are. And we know from various sources that some of these injuries that have been inflicted with handcuffs or ankle cuffs have led to amputations purely because the blood supply to their hands and feet have been cut off. And so these are the testimonies that we hear. It's not that one or two is talking about this type of treatment. This is systematic amongst the people who are being detained, amongst the nurses, amongst the doctors, amongst the paramedics who are being detained. We took one testimony from a doctor who spoke about how he kept mentioning the fact that he was a doctor in the belief that he would be treated better when he was in amongst the the Israeli military. And in fact, it had the direct opposite effect. He would say I'm a doctor, and then be hit. He would mention it, and then they would mockingly say, oh, you're a doctor, and then kick him in the flanks while his hands were tied. So we are seeing this being perpetrated against, healthcare workers who should be afforded special protections under international humanitarian law, but these are being totally perverted. This is an egregious breach of what the protections that should be afforded to these healthcare professionals in this setting.
And Tanya, when you were in Gaza just recently, did you come across healthcare workers who had been detained?
Yeah, I worked with several at the hospital where I was working who had been detained and then ultimately released. And there were several others that we knew of from that hospital and other hospitals who were still abducted and in detention. The ones that I was working with, there were some nurses and a doctor, and I did actually take testimonies from a number of them, and what they described was very similar to what Rebecca is describing. So physical, psychological, and sexual abuse. Some of them were taken for almost 2 months and handcuffed for the full duration, blindfolded for the full duration, stripped for the full duration, made to sleep on this uneven surface that was described as like shards that cut into their skin. They would have fans blowing at them, bright light, blasting lights, blasting music to prevent them from sleeping. And then they would be taken intermittently for interrogations that would essentially be in the form of forced confessions, where they would say, confess that you are part of Hamas, for example, or we will rape your mother and your sister. We know where they live in Gaza. We know where they're sheltering in Gaza right now. And then they would beat them and beat them and beat them and beat them to the point where they showed me the markings on their hands several months after they were released. And they had scarring, where they described urinating blood for several weeks after they were released, where they lost over 20% of their body weight during detention, because they were at times given at most 1 meal a day that consisted of very little calories, or because at one point one of them described being beaten so bad in the head that he was in and out of consciousness for a period that he was later told by his inmates was 3 days, and so he didn't eat anything. And so, it was levels of detention. A nurse describing how she was pulled as she was evacuating patients from the actual queue of, they're told to evacuate the hospital. They try and organize a safe evacuation for their patients in the intensive care unit. They're accompanying the patient in the intensive care unit, but are pulled out of this so-called humanitarian corridor for evacuation that they've been told has been created for them for that exact purpose. And she's pulled out of that line because she's wearing scrubs and a white coat. They don't call her by her name. They say, you, the healthcare worker in the scrubs, come here. And then she, pulled and taken and kept. And I've heard that testimony from multiple people. In fact, she told me that they all changed out of their scrubs, but because they had essentially evacuated the patients, been held at a checkpoint for hours with plumes of smoke blown at them, with people being assaulted, they were ultimately told they weren't allowed to pass, and they had to go back with their patients, and they could not go back that full duration with intensive care patients. So they ended up going to a clinic that they found and spending the night there. And she just describes the fact that as they left, she forgot to take her coat, her regular civilian coat, and how so she was one of the only people in their group that didn't have the opportunity to change out of their healthcare clothing, and that was targeted as a consequence. And they didn't call her by her name; they always called her by you, Al-Hakima, or in Palestinian Arabic, you, the nurse. And so I think what became very obvious from the testimonies was, one, the fact that they were clearly targeting healthcare workers, the fact that they described testimonies of their own torture and the torture of other healthcare providers that they witnessed in detention as being the most severe of any detainee, just because they were healthcare workers. And the fact that the degree of torture is, you know, and I'm not in international humanitarian law. I don't work with detainees or prisoners of war, so this is all new to myself and Dr. Inglis. But we're understanding very quickly that this is not what happens normally. You know, this is a degree of torture that is really so far beyond what is conscionable or allowed. And any torture is not allowed, but conscionable. And then also the fact that the types of detention, the fact that they're taken without informing their families, without an actual crime, without an accusation, a credible accusation. They're taken and detained for months with nobody knowing their whereabouts, nobody knowing their well-being. You know, all the categories of legal detention, be it, you know, as prisoners or, you know, sorry, as people convicted of a crime or as prisoners of war, require certain criteria. And these detentions fulfill none of these criteria. That is why Dr. Inglis and I tend to call them abductions, because that is exactly the way they play out. They're taken from their place of work. Nobody knows where they are. Nobody knows whether they're alive or dead, as you heard from a recent senior doctor who was kept in detention for months and then ultimately died in detention after months of torture.
I mean, I think many of us have spent the last 7 months watching this genocide unfold before our eyes and have been, you know, distant witnesses to horrors unlike anything we've seen before. But I mean, I'm struggling to think of the questions to ask you after hearing this. I don't think I've read any of this before. I mean, even in the horrible stories that are coming out in the press, on CNN, on other mainstream platforms, I'm just not seeing what you're saying. And you know, Israel has been accused of committing scholasticide, of targeting schools purposely, of targeting journalists purposely. We've seen the most number of journalists killed in Gaza in 7 months. More journalists than were killed in World War II. And if they are targeting doctors too, is that to drive healthcare workers out of Gaza? Is it to leave no recourse for the wounded? What do either of you? I'm curious to know what you think. Or it's just terror?
Yeah, no, it's a very good question, and I asked this exact question to a colleague that was detained when the Israelis invaded Al-Shifa Hospital the second time, detained and ultimately released. I asked the question, why are they targeting you? Why are they targeting the hospitals? And his response essentially was, there, you know, if you want to kill a population, you know, you target the things that keep them alive, including healthcare. And if you want to destroy a healthcare system, you destroy its beating heart. And in this case, he described that as being Al-Shifa. And that's been my, you know, because this is not something you can rationalize. There's no justification for the systematic attack and destruction of healthcare workers and healthcare infrastructure. And the only way that I can even start to understand is, you know, why are you attacking the food supply? Why are you attacking the water supply? Why are you attacking the healthcare infrastructure? The only justification is the very clear destruction of anything needed to sustain human life. So I think that's the first element. The second element is all these accusations that have gone around of Al-Shifa being, you know, a command center, or I think it's the way that it's been magnified has created, you know, has made healthcare turn into some kind of enemy or some kind of part of a military operation, when there has been no evidence that that's the case. And that was the justification given for Al-Shifa. you can't provide the same justification for every single healthcare facility in Gaza. And that justification wasn't even proven for Al-Shifa. And then the other aspect of this is some of the healthcare providers that were detained in their testimonies talk about the fact that when asked why they're hitting them, because they're a nurse. I'm a nurse. Why are you hitting me? I have nothing to do with Hamas. Why, I'm a doctor. I have nothing to do with what you're fighting. Why are you hitting me? And the response they get is because you treat Hamas fighters, or because you treat because maybe I think a few of them talked about being told by the people that were torturing them that they knew about where the hostages were when they didn't, or because they knew that they saw them on camera footage from the hospital treating fighters. And as a healthcare worker, you treat anyone that comes that comes through the doors of the hospital walls. If it was an Israeli soldier coming in, you would provide care. And actually, that's a direct quote from one of my Palestinian colleagues. I treat anybody who comes through the doors of my hospital. I'm a healthcare worker. That is what we do. And even under international humanitarian law, fighters, if they're inside a hospital, are actually
given protection. They're designated
patients until they're discharged, until they leave those walls. I think that's another justification or rationalization for something that's completely irrational that has been provided by some of the healthcare providers we've spoken to.
And Rebecca, if I can ask you about this, another thing that's coming up in the testimonies you've been collecting, that Tanya alluded to, is the destruction of medical infrastructure and specifically equipment. Again, this is not something we're seeing being reported. Can you explain to us what it means and what kind of cases you're coming across?
Yes, I think that this actually follows on very closely to what we were saying, because what we are seeing is the purposeful, wanton destruction of medical equipment in ways for which there is absolutely no possible justification. So an example of what we've seen and we get sent from healthcare workers that we're in touch with is an ultrasound machine. So these are expensive pieces of equipment that are hard to get into Gaza in the first place, and they are multiple thousands of pounds worth of equipment. So they're expensive bits of machinery. And we are seeing that when the hospitals are raided, the ultrasound probe, so the bit that attaches the bit that goes to the patient to the actual machine, has been snipped. So this isn't something that can happen by accident. This is intentional snipping of the essential part of this machine, the bit that makes it work. And the only thing that you can do with an ultrasound machine is provide healthcare to someone. It will help you diagnose what their problem is. And so this is just one example of very many. So, all sorts of specific medical equipment being what would appear to be intentionally, purposefully destroyed. So monitors, ventilators, MRI machines, CT scanners. And we're seeing that these are being destroyed in the wake of all of these raids of the hospitals that are carried out by the Israeli military. So this isn't something that's got knocked over as, people charge in the door. This is an intentional act whose only justification can be stopping healthcare being carried out. And, I think that we've been seeing this not just, on a small scale. We've had images shared with us by colleagues of Shifa where room after room after room is filled with medical equipment that has been destroyed. So it's not just the images that you see more commonly in the media are entire hospitals destroyed kind of beyond recognition. So you'll see those images, but what you don't see is the intentional acts, what appear to be kind of intentional acts of destruction of medical equipment.
And you know, one of the things that to me was haunting were the images of the ICU wards, the neonatal intensive care units. And just from what you're saying, ultrasound machines being broken, the incubators, is this, I don't know, it sounds as though they're targeting specifically children, women. I want to ask you both about the question of malnutrition, which does impact children and young babies specifically. I mean, before they have a chance to live, they're condemned to death, either from dying of starvation, or in the case of malnutrition, it being a lifelong, I don't even know what the word is. One runs out of words listening to all this. The effects of malnutrition that will stay with a child for life. What are you seeing in that sense in Gaza and in the testimonies? Either of you, whichever feels can answer.
So I'm happy to just talk a little bit about that initially, and then if Tanya wanted to add anything. I think that the thing to say is that malnutrition is ravaging the population at the moment. And as you allude to, this isn't something that can be cured by, you know, giving a little bit of food here and there. At the moment, this intentional starvation of the people of Gaza will have lifelong ramifications, not only for the children, but for the other people. With children specifically, we know that the complications of malnutrition, so having had this period of enforced starvation, means that it's going to affect their development, both physical and mental, their educational attainment going forward, and it's going to affect them, you know, for generations to come. In the here and now, it is having equally devastating effects, though, because it is exacerbating the risks of everything else that's going on. We know that the living conditions at the moment are dire. We know that the sanitation situation is terrible. And because they are rendered so vulnerable because their bodies are starved of the nutrients that they need, they are at extremely heightened risk of dying. We know that a severely malnourished child is 11 times more likely to die than a child who has appropriate nutrition. So we can see that children are coming in and dying of the sorts of things that a child shouldn't normally die of. We know that the wounds aren't healing. So a colleague of ours got back from Gaza a few days ago. He said, you know, he talked of 2 teenagers who had had injuries that, had they not been malnourished, they would have survived, but their bodies had no defenses because of everything that they'd been put through, because of the enforced starvation. And this is just so devastating to deal with as healthcare professionals, because it's manufactured, because it's man-made, because it's caused by the actions of Israel. That is why there is malnutrition there at the moment, and that's why it's just so devastating for us as healthcare professionals.
Tanya, do you want to add anything to that? I suppose I'd love to know what you have to say, but also how it is that you survive being in environments that we've been listening to you describe. How do doctors continue their work in the face of this kind of horror?
I don't know, Fatima. I did it for 2 weeks, and you know, me and my entire team, we were utterly exhausted from living in a hospital for 2 weeks, working continuously, which is the case for essentially almost every healthcare provider who's working in Gaza right now. Exhausted from back-to-back mass casualties and the emotional toll that takes on you. And just the, you know, every time there's a mass casualty, you get this adrenaline surge as you're trying to save lives. And, you know, Rebecca and I will both tell you, as intensivists, you're exhausted by the end of a shift like that, like completely exhausted. And they have no recovery. We get, you know, several days of recovery, and then in our homes, in the safety of our homes, well nourished, not worrying about the lives of our family members. They don't. They do that. They go back to a tent, and if they're lucky, some of them don't even have a tent. Some of them sleep in the hospital. They go back to a tent, And then they come back, and in the entire time they're in their tent, they're worrying about the food security of their family members, the safety of their family. And then they come back and they do it all over again. And the other type of exhaustion, which I think we don't talk about enough, is just like an utter and complete emotional exhaustion. You are watching loss every second of your day. You're consoling a father who's just lost his entire family, a mother who's 7 days postpartum, had a baby 7 days ago, and her newborn baby's trapped under the rubble and dead, and her 3-year-old we can't find, and her other children are clinging onto her as she sits in the wheelchair, clenching her own abdomen because she's under, she's just sustained the crush injury, and we're trying to figure out the magnitude of it. You are there consoling these people and bearing direct witness to their suffering. You are exhausted. In fact, I have a lot of things on my desktop right now, as I'm sure all of us are in the last months. One of the things that's open on my desktop is WhatsApp. And as you're talking, one of my colleagues, a foreign colleague who's currently in Gaza, I'm just seeing the words pop up. And I asked if he's okay. And I say, I'm so fatigued. And I can't read all the messages, but literally as I'm answering your question, and the last message, and I'll have to open to see what the rest of it is, weight of it all. And I think that's exactly how we feel, how I felt after 2 weeks, is the weight of everything, the physical exhaustion, the emotional exhaustion. And I was able to leave, to go back to safety, to go eat, a fresh apple, because people in Gaza haven't seen fresh fruit in 7 months. I had an apple in my bag from Cairo that I forgot that I had put in my bag as I was leaving. And 4 or 5 days after arriving in Gaza, we were having the pre-dawn meal because it was Ramadan with some of my colleagues in the emergency department. And I wanted to contribute something because they had cooked up some canned spam. And I wanted to contribute something. So I went back to the room where I was sleeping in the hospital, and I opened my bag and I pulled out some cereal bars that I had brought with me. And this apple, and I'm thinking, should I give this? Should I bring this down? It's kind of beaten at this point, there's a bunch of bruises. But I took it down and I opened my bag and I threw the cereal bars on the ground, where we were about to eat. And then I pulled out the apple and I put it there, and the entire room went quiet. Everybody just stared at the apple. And I said something, I didn't realize it was the apple. I said, do you guys like these cereal bars? It was just such a weird reaction. And they're like, no, we haven't seen fresh fruit in 6 months. So I cut the apple in very small pieces so that everybody could get a bite of apple. They have not had fresh nutrition in 7 months. And I can't even, I mean, they're exhausted. And I guess your other question, Fatima, is how do they sustain it? It's a very good question. I don't know. How did we survive? Honestly, they took such good care of us. Our Palestinian colleagues took such good care of us. Every single day, they were trying to feed us, to make us laugh, to make sure we had a cup of tea with them and took a break. And they took such good care of us. And I think we survived because we had such a great team, both internally as our group, but also more importantly, the Palestinian team that welcomed us, hosted us, and made sure that we were taken care of over those 2 weeks. And how do they survive? I've never met a population that loves life as much as Palestinians do, and particularly the Gazans that we were working with. I can't imagine. I think a lot of it is months and months of fight or flight. And as soon as they come down for all of this, I suspect it's going to have a huge toll on their health, especially their psychological health, once they have a chance to process everything that they've witnessed and been through. But I think they just love life. And even now, after we've left, I hear from them every day that there's reception, and they want to know what good things are happening in my life, and they want to crack jokes, and they send me memes. And I think there's just this will to keep living, even as the beating heart of your entire ethnic population is being targeted for death. And I think that's it's a form of resistance that is so beautiful.
I just want to, as we close, I want to just read something that I read on the Gaza Medic Voices page that stayed with me. It's a testimony from the head of the Kuwaiti hospital, sent on the 11th of May. There are no more messages to send the world. If people have any conscience, then they should get out into the streets and surround embassies to demand a stop to this aggression. The situation is catastrophic. There are no words to describe what we are dealing with. There is nothing more that can happen to prove people's conscience. What we are asking is that people don't continue to live their lives as normal while they watch us on the news and calm their conscience with empty words. What we are asking is for everyone to get out into the streets and squares to surround the embassies and stop the torrent of Palestinian blood. I just want to thank both of you, Dr. Tanya Haj-Hassan and Dr. Rebecca Inglis, for being with us today, for talking to us and for sharing these testimonies. Thank you so much for your time and for all the work that you are doing. And if you want to hear or see more coverage from Zeteo, please go to zeteo.com and subscribe. Thank you.